Hi, I'm Eric Herter with Reed MD-VIP Affiliates. In medical school, you get exposed to all the various specialties, and for me, I really enjoyed everything, and so one, really liked the general nature of internal medicine because you really get to dabble in a lot of things. But then also I also learned how much I enjoyed relationships and the opportunities when you got to see patients over and over and get to know them and follow their health conditions over time. And so internal medicine is the perfect blend of those two passions or preferences. The relationships, first and foremost, they may open up more easily, but also when you know them, you can say, hey, something's just not right. I know you, and this is much more than what you're telling me, or it's not exactly what you're telling me. And so it's a skill you learn, but it's also just in any human relationship, that's part of the benefit of knowing people. I certainly get excited when people have wellness success, when a light bulb goes off, or when we can see something turn around because they've been able to make the day-to-day changes that all of us want to make, but behaviorally it's so hard to achieve. But then mostly the breadth. I do a lot of different things. I do a lot of nursing home care. I still do a lot of my hospital care. I have patients from teenagers to 102. And then I also take care of a lot of patients with intellectual disabilities, and I enjoy that too. And I really enjoy the variety and across the spectrum of patient type and age. I think I've used that term a lot, but the relationship is very important to me. I'm big on collaboration and to try to work together toward wellness goals, or when there are threats to wellness like disease or conditions or injuries, to work aggressively to prevent those from being a major threat to wellness. So it's certainly a hackneyed term today, wellness, but I think it is very important when you get down to the root of it, no question. So. I'm married to a family practice physician here in town, Pamela Herter. We have 3 teenage boys, and we're surviving. And we love Lawrence, and we love Lawrence Memorial Hospital. One simple saying I always like to look at is you can't change where you've been, you can only change where you're going. So I think with health and wellness, we get discouraged and frustrated by the things we've struggled with, but today and tomorrow, they're new days, and to keep working on things. So. Because it's a community hospital with the spirit of a community hospital, but the robust service line and technology that you're going to find in a cutting-edge hospital. So.